back with Brunch, a taste of Tobago. Now, I told you guys it's Wednesday. It's a wonderful Wednesday on the island of Tobago. And we thank you so much for joining us. Thank you so much for being a part of Brunch, a taste of Tobago. And of course, this is our Health Corner segment. I absolutely love Wednesdays because I get to have such intriguing and educational conversations with the guests who sit before me. And of course, today is no different. Mr. Pelham McSween joins me this morning, and we are going to be talking about the importance of education in chiropractic care. And it's always a joy when he comes on because we talk and talk and talk, and sometimes we forget about the time. So, guys, forgive me, and you have to keep me on point today because we're no telling where this conversation going. So, Dr. Mark, good morning to you.
Glad that you can have me back.
And a Happy New Year.
Oh, same to you, and thank you.
Yes. So, quite a buzz, quite a whole conversation, a whole narrative that's taking place now with regards to chiropractic medicine, with regards to education of what a chiropractor should do, should look for, so it's...
And what they should know.
And what they should know. And when a patient walks in, what do you do when faced with a patient walking in?
Exactly.
Yeah. So tell us a bit about some of the things that, as a chiropractor, you should know. What should come like second nature to you when a patient walks in?
When a patient comes into the office, first of all, it's a different patient. A person may have come in with the same symptoms and so forth, but you have to treat that patient on their own base, and that is what they're complaining of to you, and not say, well, it's the same thing like Johnny Adams or whoever came into you previously. So I've learned neurology, neuroanatomy, physiology. That is part of your training. And so I was explaining to you recently that if the chiropractor doesn't know that, then we have a problem. And so 10 persons coming into me is not a back-cracking exercise. It's not that because you say you have this, I'm going to treat you the same way like I would have treated another patient previously or even days before. So I have to analyze you. And the only way I can analyze you, as I've said, is to be able to analyze and investigate, peruse the x-rays to identify possible problems and cause of the problem.
What about interpretation? Because this is like a really, really vital part. Before you even give any type of diagnosis, you have to be able to interpret.
You must interpret
what's before you.
And patient may come in with a host of problems. A patient may come into you and say, doctor, I have a scan, and can I bring it with me? And of course, bring the scan, because you want to look at the scan. Sometimes in the scans you see kidney problems and so forth. A patient comes in and patient say, doctor, can you fill this form for me? And I'm say, well, can't you fill it? He said, well, I forgot my glasses in the car or whatsoever. I forgot it home. And so you must be thinking now, this patient has a sight problem. And you continue to analyze with perspicuity, because it must be clear coming to your head, this is the information the patient needs.
Referral of medical care. Now, I'm thinking this is something that you should be so educated on. That you give the proper referrals. Because at some point in time, the visit would not stop with you. They're not just going to come to you and everybody goes home. Like you just said, there could be a host of other issues that may arise. Sometimes you may have suffered something as a child and it's now bothering you at that pioneer age, right? And so this brings us back to before even doing or going into that conversation, which is diagnosing the issue. There's so many other things happening. The body is connected.
Yes, absolutely.
Yeah.
Absolutely. There's no disconnect there. And I think I sent a reel concerning doing an online course with chiropractors
Yes.
as a continuation course, and so that they become more acclimatized and sensitized to some of the problems they would encounter in their practice.
Yeah. And one of the things that we really need to take the time and be as much on top of our game as we should, because you don't want the instance where you misdiagnose someone. These are the realities. We have heard some of the horror stories. They're out there.
Oh, absolutely.
Yeah, but
Absolutely.
misdiagnosis is something that you really, this is like the number one. If you had to put like a big NO at the top, that is misdiagnosing a patient.
Yes, absolutely, absolutely. And you have to be on the button when it comes to that, because the patient needs credible information
Definitely.
so they can make sensible decisions as to as they advance in the care. A patient may come in and say, "Well, doc, I have a pain in my knee, and it was recommended to me to have a knee surgery," and they may have brought in the X-rays. You must be able to analyze those X-rays and say, "Well, listen, you sure? Don't you need another opinion?" And so, listen, go and see this person or that person and stuff. And they come back and say, "Well, they gave me a shot in my knee, whatever the shot was, and they had a decrease in pain and so forth." But when you analyze the X-ray, you must know what the real need is supposed to look like.
Yeah, exactly.
And if you don't, you're in trouble, because you would not be able to tell a patient, "Listen, you have sciatica," and they may say, "Well, what is sciatica? I never heard the term." So sciatica is when the sciatic nerve is squeezed, and usually there's a leaning of one or two of the bones in the lower back,
Right.
that would cause that, particularly L4, L5, and S1. And now you go into the patient's back, you adjust those bones, and the patient gets up and bend the knee and says, "The pain is gone."
Yeah.
And now it's contingent upon you to explain to the patient the whole process why it is so. And the patient doesn't have to change the knee at all.
And what about our young enthusiasts? Do you see a large number of youngsters wanting or interested even in chiropractic
Yeah, well,
medicine?
I've had a lot of calls from youths seeking information because they want to be chiropractors. Even grown-ups, I've
Yeah.
had calls from them. So previously, when I came to Trinidad, it wasn't like that. But I continued, as I said on another program, to have this conversation with them,
Yeah.
with the parents. And the parents would come to me and say, "Doctor, I have a son. He has this or that. Can I bring him to see you?" Right, and comes to see me and stuff. And he gets over the table and he said, "Mom, so all the pain's gone, Mom." And so he wants to know, he said, "Well, how this thing works, doctor?" I'll have to
Yeah.
explain in a way that he would understand, to stir him into having that interest. And but I see some of that happening.
The narration has changed so much,
Absolutely.
and I made mention of the youngsters because I want to get to your brainchild, which is the college
Yes.
that
Yes.
is dedicated
Yes.
to this form of medicine. So,
And to Tobago.
yes, so let's
Yes.
touch on that just for a bit. What is the name
Right.
of your
Well,
college?
and when we started early on in the program, I told you I wanted to build a college in Grenada. But because of the land issue, family and stuff, I just put it to the side. And then recently I started to think, a couple of people say, "Doc, why don't you come to Tobago?" And we had a conversation going on. And so I came up with the issue about getting a college here in Tobago of chiropractic. Only chiropractic.
Right.
We probably could extend later on in other things. But and so the name of the college is after my daughter. Alexandria Philippa McSween. And it would be named Alexandria McSween's Chiropractic College campus of Tobago.
Right.
And it led on from there to a plan, which came into being as a proposal. So at this stage, this is where we're at, and we're looking at it probably to begin some form of construction January in the dry season, January of 25.
Yeah.
The foundation takes sometimes a lot of rain if you go in there in the rainy season, and you have to pay equipment and so forth. So we want to, of course, reduce cost. And so that's how the name of it came about, because of my younger daughter, who just graduated out of UWI.
I love it. I love it. I love it. And I know that you're in the infancy stages.
Yes.
But you have a focus, and there's a particular foresight there. So a student who is desirous of attending this institution, what are some of the criteria that they need to have?
Well, the student must have a Bachelor of Science degree. Some Bachelor of Sciences do not have certain coursework.
Right.
Now, if such a student wants to apply, they can apply, but they must get those coursework finished at a tertiary institution before they can be accepted into the college. So you must have a Bachelor of Science. And some of the basic coursework you must have in your Bachelor of Science is physics, chemistry, inorganic, organic, general chemistry, math, and might be some other ancillary courses you may have taken. But those are the basic courses. And you may have calculus 1 or 2. But the better your grades are, is the more possibility that you would be accepted. And of course that comes into acceptance committee, evaluation committee, who will go through that process.
What about teaching and staff? Because it's so important to have that synergy. So it's not just having built an institution, but the teachers, the facilitators.
The source we looked at is right here in Trinidad and Tobago. Our first source of educating, being educators at the institution. If we cannot source those individuals, we'll have to seek elsewhere, seek more of the Caribbean. But first of all, this would be our focus, the Caribbean.
Yes.
We have enough graduates from the university here who can probably fill some of those slots and teach some of those courses that we require.
Yeah.
You know,
You have this love. There's a patriotism that you have.
Yeah, I'm a patriot.
Yeah. It's just shining through you today.
I'm a patriot. Trust me, I'm a patriot. Of Trinidad. And I think I just got an advisory committee award from the United States from the Republican Party. So, yes, I have that patriotic spirit in me. I think it started when I was a police officer.
Yeah.
And it led on into me going into the military in the United States and so forth. But yes, I see these countries, this Twin Islands, stayed as foremost in my mind.
Definitely.
I love America now, trust me.
Yeah. But there's something about the Twin Islands.
Oh, my mother used to say something about where your navel string is buried. That is where you will be.
Yeah.
So probably holds true to that.
I love it. And I think with regards to continuity, because we need to have that conversation always. One of the things that we have been accused of as West Indian people is not knowing how to build and ensure continuity in what we're building. And I think the narrative is changing. I'm not sure how quickly, but I think it's changing with regards to us and business and enterprise and innovation and,
So we have my daughter as director of student services and very intelligent young lady. And so part of that continuation is going to come from her if I pass away.
Yes.
And she would be one of the directors at the college as well. But we have some great people here in Tobago, trust me.
Yeah, I
We
think
have some
so.
thinkers here in Tobago. I've met some of them.
Yeah.
Yes, I have.
And it's a wonderful opportunity as well. I think there is so much to be said for the types of minds that we have. And you get to showcase that as much as possible. It's not just about the continuity. It's not just about, having a education, a facility, organization, institution, whatever we want, whatever term we want to use. The human aspects is so important. And I know that you speak to that. You talk about it every time you come on.
Yeah, it might
The
help us
human aspect.
to decrease crime as well. Because we
Yes.
have an outlet for our people.
Okay.
And the more we educate them, the more they turn away from crime.
Definitely.
And it must start from young.
Definitely. And you know what? We're going to take a break on that note, guys. We're going to be right back with more Brunch, A Taste of Tobago. We're going to be chatting just a bit more with Dr. Pelham McSween, who is here and just doing the most right now and just giving so much back to the community. So we're going to be right back with more Brunch, A Taste of Tobago. Back with Brunch, A Taste of Tobago, and of course it's our health corner segment, and I'm speaking with my favorite chiropractor doing the most in the building on the Brunch set today, Mr. Pelham McSween. And of course we went for a break, and of course you mentioned that the Tobago space was very much responsible for this initiative.
Absolutely.
Yeah?
I am so appreciative of the education department up here because I was given the opportunity to go into the schools and to give care to primary school students. I did this on a monthly basis for years. Parents used to sign consent form for me to touch your children. I had a similar experience in Grenada, but here took the cake.
Yeah.
I come up to Tobago and sometimes I don't have to make breakfast when I go to my office. Patients would come in and bring me breakfast.
Yeah.
That kind of thing.
And yeah.
So that was a big boost to me, and that kind of catapulted my view into terms of the way forward. And that's why we're at this stage now with the design and construction, the planning, the whole bit of the college. And we now looking for some land.
Yeah, well, I mean,
we're looking for some land.
You gotta step by step.
We're looking for some land, and we hopeful that we can bring this about with the help of Tobago. Because this would be a Tobago thing. It's going to help with health, tourism. I see a big cruise ship outside there.
Yeah.
Some of them, when they come here, they come to my office looking for a chiropractor.
Yes.
So that institution would be able to facilitate all these people.
And I think being in this space, it lends something to the experiences that you would have. For you, the Tobago space is one of kindness.
Yes.
You always speak about
absolutely
the kindness that was shown to you.
Absolutely.
Yeah.
Absolutely.
Yeah, because your patients, you said you got the opportunity to go to schools. You were entrusted with caring for
their children.
For their children, yeah.
I used to be invited to their homes for lunch. Doctor, come by me for lunch today.
Yeah.
Mangoes. I don't have to buy mangoes. I found that to be amazing here in Tobago. Amazing.
Yeah.
The people reminds me of my mom being from Grenada.
Yeah.
So I say there's a connection.
There's always a connection. I think as West Indian and Caribbean people, we are all connected. Our history is so
intertwined.
yeah, it's diverse, yet we're so connected
Yes,
in
very,
terms of
very, very connected.
experiences. Yeah.
Actually, I had teachers go down to Grenada from here to
Wow.
meet with school principals and so forth.
I love the fact that you are so passionate about the health of our youngsters, the health of our children. You're such an advocate for the youth and what they got going on
Oh yeah,
because it's quite a lot
yeah.
going
We,
on.
we must we must educate them and feed them
Yeah,
that opportunity and ability to be the best of themselves,
definitely.
and they can be.
And we must also highlight the positives.
Yes, well, all the time.
Yeah, we need to highlight the positives.
Month before last month, I came up here. I got a call, and person said, "Do you remember me, Dr. McSween?" I said, "I can't recall." She said the name, I couldn't recall, and she said, "I'm going to come to your office." And the morning she came, I went to my reception area, and there was this big basket of fruits and flowers to me. I was amazed. She said, I was going to Black Rock and you used to see me. It's amazing.
Yeah.
It's amazing. Those fruits lasted me about a whole week.
Yeah. And that speaks to the human aspect because we always have to come back to that.
Yes.
It seems to be fleeting just a bit, but we are trying so hard to bring some semblance back because it's so important to have that human aspect. We have to love one another. We have to show kindness
And that's gratefulness,
consideration. Yeah.
That's gratefulness. Imagine that. Years I haven't seen this for years. So I like a little girl in Black Rock when I first started. And I was amazed. Took me to tears.
Yeah. And it's amazing when someone so young at the time
Can remember that.
remembers that
Yes, yes.
in detail. So that means there's an impact there.
Yeah,
that happened.
it transcends
So
my belief. It transcends all I know, my reality. I say, wow. When I told my staff, I say, isn't there something?
Yeah, it's amazing.
This is something else. And I see it sometimes in the South in Trinidad. A patient came into me and said, "Doctor, what do you like to eat?" I said, "Well, I like cow heel soup and all them kind of stuff." She said, "Okay." The next week, she and her husband came with a big pot of cow heel soup to me. I said, "You all didn't have to do that."
I could do with some of that now.
I talk about only cow heel.
Yes.
Oh man, it was something else. It blew me out of this world.
That love.
But I see that here every single month. Monday we had breakfast when I came in. Nice breakfast too.
Yeah. What about funding?
Well, we're gonna be looking for funds. Of course, we need money to build the college. Along with that, we want to twin with my alma mater, Sherman College in Spartansburg, South Carolina.
Right. Yeah,
part
that
of
you always speak about.
So they can come here, they could do internship here. Our students here can go there, do internships and so forth.
Yeah, I love it. I love it.
But we're looking for some money. Trust me, because you got to get that money to build it.
Yes.
We're looking for help.
And you're in the right place to ask for help. Have you approached any of our local bodies?
Oh yes.
Considering help? Okay,
we decided to petition the THA. See if we can get some land. We haven't met with them yet. We're supposed to meet tomorrow.
Right.
And when that starts, when we get that, by God's grace, things should be on the roll. And of course, we're going to have to look at a lending institution to help us accomplish that feat. So I'm hopeful, and my board is hopeful as well.
But I absolutely love what you're doing. I think you're such an inspiration to so many of us. A household name. Like I said, I knew you before all of this even came to fruition. I remember you on other networks and you were so in touch with your craft. That's why I remembered you. And then I started this show and you were one of my first guests. And the rest, as they say, is history.
It's history.
Yeah, because there's always so much information. There's always that willingness to share. And that's a beautiful thing.
I think that's why we're here.
Yeah.
We need to help our fellow men. We should be our brothers' keepers
Definitely. I think
and
so.
share the good, even the bad sometimes, with our people, so that they understand. So there's a path for growth and development.
Yeah. And I love the way that you said we should be our brother's keeper.
Yeah, of course, absolutely.
You know, because to some of us it may sound very cliche, but it's so true and it's so important that we have that comradry and that mutual respect for one another.
The caring.
Yeah.
I can give you a little narrative in this. I was at my office in the morning, and I left my office just to go to TSTT to rectify an issue. And by the time I got out there, I got a call from my daughter. Daddy, we under gunpoint. And some bandits had gone into my home, hit my daughter in the head with gun butts, planted her in her arm with cutlass, threatened to kill her unless she released anything we had in the house, which she did. And then they came for me. So I said, probably because the way I understand what chiropractic.
Yeah.
They said they came for me. So but I'm not scared of that. I'm not worried. The police we have some good policemen, trust me, here.
Yes, we do.
And of course,
We do.
God had all to do with it. But they responded in no time at all. You hear me? And they locked down the place. I always say, thank God for our policemen.
Definitely.
Yeah, they do a tremendous job, trust me.
Yes, and good morning goes out to our protective
Yes,
services.
yes.
They really do the most. And in sometimes
They
very,
literally
very
have.
trying, circumstances and resources in many
Yes,
cases.
absolutely.
It's a bit trying to even get the job done. But
Anybody bashing the
get it
police
done.
have a problem.
And you have your own experience.
Oh, yes. Oh,
And so
yes.
you can speak on
Yes.
the experiences that you have.
I
Yeah.
was a young policeman
Yeah, definitely.
trying to build police force and service. And I can tell you, it's very challenging.
Yes, it is.
So when something happens and the police say, well, this is what we did. Everybody say, oh, no, the police do this. No. Without them, we'd have no law and order in Trinidad and Tobago.
Yeah, you
The army is
definitely need-
the army is not designed for law and order.
Get you.
When I was trained in the military in the United States, I was trained to kill you. I was trained to protect my country.
Yes.
Right? The army is not trained with the law. I never learned the law, except if I went to JAG school. And but I've been through the training here. They teach you to protect and serve.
Basically, and that's just what it is.
So I was saying that we must be our fellows keepers.
Yes.
And so the educational aspect is absolutely necessary. And so that's why I want this project to succeed. Because you have a lot of young Tobagonians here who can be and do what I do. Trust me.
Definitely.
So that's when people say, as you were saying, God gave me the gift.
Yes.
He gave me the gift of life. And I try to utilize that life that He has given to me. And we have young men and women here can do just what they saw me do on the set. Like I put say, Dr. McSween, how you did that? And that kind of thing. And they can do it. So that
Definitely.
legacy would be there. We can have some great chiropractors right here. People would be coming right here in Tobago to get adjusted. Because I have people from abroad coming to Trinidad to be adjusted by me. I just had a
Yes.
patient or two or three of them, one from the States, and one from Ireland, and one from Grenada, coming to me because of what they've heard me speak about and my videos on Pelham McSween's Memorial Chiropractic Healthcare Center.
Yes.
And they came here. But we could have a dynamic process in Tobago here.
I think so.
And this island is geared on tourism.
Yeah.
There's no oil drilling here. There's no asphalt lake here and all kind of stuff. But we have a lot here.
Definitely.
You have a
And
lot
a
of hair.
natural essence that makes us unique.
Yes, yes.
And I think we
It
need
makes
to,
Tobago.
yes, yes.
You know?
But we have a video, a
Yes, we have a
reel
video.
from you.
I was
Yeah,
doing
so let's cue that and
okay.
you tell us, what's happening there.
Okay.
Yeah.
Good
Let me
morning,
just ask about
doctors. Continuing our discussion on the cervical spine and its analysis. As you can see, we have a lateral view, base posterior view, and an open mouth view. In the lateral view, you can see there's a listhesis. You see movement of C1 all the way down to T1, T2. And there is string sign, there's cholesterol source developed in the carotid arteries. And so let's take a view at other spines. Now, each spine coming into you as a prospective client is different. This here is another spine, as you can see. It has lost its curve, its lordosis. Seems like a military neck. You should understand that term and know what the term means. And here again, we see movement of the cervical spine, lateral movement from C2 down to about 2 or 3. This here is another patient's x-ray. As you can see, there are osteophytes, there's lipping of the end plates, superior and inferior, and there's a posterior movement of the posterior tubercle of C1. And over here, the string sign is very noticeable. Again, there's movement of the cervical vertebrae from one side to the other. In this one, you're seeing the bifid odontoid process. As we continue our discourse, we're going to get into pathologies and signs that you should look for to aid in the wellness of the patient. I want to turn on to MRI and look at it.
Yeah, and one of the things that I actually love is the fact that we get to meet a very wide and vast cross section of our people, our creatives, our service providers, you name it, and they are right here on the brunch set. This is one of the things that I absolutely love about it. And of course, we had some video that we wanted to share with you guys. I asked for it to be queued so that we could just speak just a little bit about it. I feel like you guys need some more information. I was leaving you and I said, let me come back because I feel like there's some information that you guys would need. So we have the video to be queued. And while that's being done, I'm just going to find out from Dr. McSween what exactly we would be looking for in the video as it's queued. So tell us just as the guys are queuing up, yes, what are some of the things that we would be seeing in the video?
But this is an actual exercise that I went through with the patient. Patient came in and patient was telling me that, doctor, I have some other x-rays at home, scans and so forth. Can I bring them? So I said, bring them. And when they bring them, I went through it and I told him what I was seeing, particularly the scan for the brain. I saw he had a problem with sight, and on viewing the scan, I said, well, wait a minute. And by the way, this is an exercise for chiropractors now, so that they become more sensitized as to what they're dealing with. And I said, well, man, you have high cholesterol deposits. You got deposits up in your carotids in your neck. You have it in your circle of Willis. And if you do have it there, you have it at your retinal artery and so forth. And in fact, yeah, he was having problems seeing. I said, well, you need to see a medical doctor so he can help you decrease that cholesterol content in your system, and probably a nutritionist to change your diet and so forth. And in fact, it helped.
Yeah. And I love the fact that you got the chance to really explain. I know the viewers were seeing the images.
Yes.
Some people may understand, some may not. So I just wanted to make sure that I came back with you so you could just give a little snippet of education and
Yeah,
information.
remember that chiropractic is about the spinal column. It's not about anything else.
Right.
But you've gone through the process of education in school to graduate as a doctor of chiropractic. So you got to use that. And so this lecture for chiropractors is telling them how to use that knowledge
Definitely.
and give the patient correct information. All right, and say, listen, this is so and so. I would recommend you to Doctor Who, but I need you to go and see them because this will also affect your health.
And I love the fact that you look at things holistically. So, again, we wish you so much blessings.
Thank you.
I absolutely love the continuity. I absolutely love the fact that this is something that is being built and is going
Yes.
to grow from strength to strength.
Yes.
So blessings to you and
Thank
all the
you.
best.
Thank you
Yeah?
so much.
So we're going to take a break, guys. We are going to be right back with more Brunch, A Taste of Tobago. Of course, our book club is going to be alive and popping. You guys do not want to miss that. Jewel Green George joins us. And of course, we get to speak to some of our lovely competitors in the National Calypso Monarch semi-final round. We're going to be right back with more Brunch, A Taste of Tobago. And of course, don't forget our trivia question, guys. The white in the national flag, what does this color symbolize? Simple, simple, simple. The answer at the end of the show. See you guys soon.